Hello students, good morning. I hope you all are safe and healthy at your home. Welcome in lecture number 6, paper number IC-506, Synthetic Drugs, unit number 3. In last lecture, we completed antihistaminic drugs. Now, in this lecture, we will discuss about anticoagulant drugs. First of all, we introduce anticoagulant drugs, and according to our syllabus, we have four anticoagulant compound: dicumarole, tromexan, Finindione and Valium. In this lecture, we will synthesize first compound dicumarole and remaining three will be discussed in next lecture. So, first of all, we discuss about introduction of coagulant drugs. Coagulant drugs. For anticoagulant drugs, we classify it in a hematological agent. So, first of all, we discuss hematological agent. These are the drugs which can act on blood and the blood forming organs. Drugs which are used for blood and blood forming organs are known as hematological agent, and these are two types. Hematological agents are in two types. Number one, anticoagulant and coagulant drugs, and number two, anti-anemic drugs. According to our syllabus, we will study only anticoagulant and coagulant drugs. So, we discuss it in detail: anticoagulant and coagulant drugs. In the normal conditions, the blood remains in the fluid state and it thus circulates readily through blood vessels. However, in the abnormal conditions, the blood may be clotted in the intact vascular system under the influence of some substance. The clotting or coagulation of blood interferes in the circulation of blood, which leads to serious results, even death in some cases. Please note that it is very important point. The clotting or coagulation of blood interferes in the circulation of blood, which leads to serious results, and sometimes death is also created. So it is very important, a very important compound, anticoagulant and coagulant. It is to be remembered that the clotting of blood is also an important defensive mechanism which plug the vents in the walls of blood vessels form as a result of injury and thus arrest bleeding. It is also known as hemorrhage. If some blood is taken out, it will clot. This is the mechanism. If some blood is taken out, it will clot. However, it is only under abnormal conditions that the clotting of blood, called thrombosis, will take place in the intact vascular system. So, in our routine actions, thrombosis process will take place and blood is clot. Clotting of blood is completely a biochemical process. It is biochemical process. This is explained by classical readily given by the Moravitz in 1905. The scientist who was described the biochemical process for clotting of blood in 1905. According to this theory, blood contains various factors such as fibrinogen. What is fibrinogen? A protein which forms insoluble protein fibrin. And number 2, a protein prothrombin, ionized calcium, platelets, thromboplastin, and some other factors. These are the blood's main constituents. Blood contains fibrinogen, protein thrombin, ionized calcium, platelets, thromboplastin, and some other factors. The fibrin, the solid material of the clot, is formed by the following series of reactions. We stated above that the clotting of blood is biochemical reaction. So this biochemical reaction is described here. First of all, anywhere tissue damage. So, thromboplastin, a lipoprotein molecular weight 1,67,000 found in tissue. Its molecular weight is 1,67,000. This thromboplastin is found in tissue, blood and saliva. The second reaction for blood clotting, prothrombin, that is glycoprotein. Molecular weight of this glycoprotein is 68,900 and it requires vitamin K for synthesis in our liver. So thromboplastin is synthesized in liver and vitamin K is required. If deficiency of vitamin K is found, then prothrombin or glycoprotein will not be synthesized. This prothrombin reacted with ionized calcium Ca+2, thromboplastin and other factors transfer it into thrombin, that is globulin protein, molecular weight 33,880. So in this reaction, prothrombin in presence of ionized calcium, it converted into thrombin. Also we say glycoprotein is converted into globulin protein. And last, number 3, fibrinogen, that is from second reaction, globulin protein molecular weight is 4 lakh. It is first of all transferred by thrombin in fibrin, that is monomer. Now monomer are treated and gathered to make polymer of fibrin, and this fibrin as a polymer compound, number of very high molecular weight compound is clot. So fusion of cell, platelets and polymerized fibrin clots our tissues. That is the biochemical reaction for the clotting of blood. Now, the process of coagulation can be distributed by interference with the mechanism or some of the factors in the above scheme of coagulation. We describe it in three steps. In order to prevent the coagulation of blood, the following methods are available. Here, some methods described for coagulation of bloods. Number 1, by stabilizing the pellets and preventing their disintegration by a hydrophobic agent such as paraffin, amber, collodion, or silicone coating on the surface. Number 2, by removing calcium ions with oxalates, fluorides, citrate, shop of alkali metals, ion exchange resins, EDTA, etc. Number 3, by interfering with formation of prothrombin with dicumarol, tromexan, phenyl indanidione salicylates, sulfonamides, etc. for the interfering with formation of prothrombin. And number 4, by inhibiting the conversion of prothrombin to thrombin. This can be achieved by using agents such as heparin and other sulfuric acid esters, salts of rare earth metals, organic bases, reducing agent, soramine, etc. for the inhibiting the conversion of prothrombin to thrombin. Now, coagulant. Coagulant. We discuss about coagulant. In the normal conditions, the coagulation of blood in vascular system is prevented by an organic substance called heparin. That is the important name heparin, which is produced by liver. Heparin is produced in liver. Second point, in these conditions, there occurs the proper balance of all normal factors in the circulating blood, that is, coagulating and anticoagulating, and thus the blood does not coagulate with the vascular system in normal conditions. If there occurs the blood injury, as if the blood is shed, the blood should coagulate in normal conditions, but in abnormal conditions the blood does not coagulate, and conditions of hemophilia occurs. Hemophilia, that is excessive bleeding. And last point, this can be cured by treating with certain drugs called coagulants. So this is the main process for coagulant. Now, anticoagulant. Retardation of clotting is important in blood transfusion to avoid thrombosis after operation or from other cases to prevent recurrent thrombosis in phlebitis and pulmonary embolism, and to lessen the propagation of clot in the coronary arteries. This retardation may be accomplished by agents that inactive thrombin or those substances that prevent the formation of prothrombin in the liver, that is coagulant drugs. These agents or substances which retard clotting are called coagulant. The various requirements of ideal anticoagulants are as follows. Here some idea is listed out for ideal coagulant. Number 1, it must be useful orally as permanently, as for example, an intradermal injections. Number 2, it must produce rapid honest of action. It is very important point. It must produce rapid honest of action. Number 3, its side effect should be minimum. It is also important. The anticoagulants are not side affected. Number 4, there must not be any cumulative action or toxicity when administered for a long time, especially in ambulatory patients. Especially in ambulatory patient. In this patient, treatment is long time. So it must be cumulative action or toxicity when it is used for long time. Number 5, elaborate laboratory test must not be performed to test its action. Number 6, if there occurs an overdose, it is also very important. Overdose, the effect must stop as soon as there occurs the withdrawal of drug. And last, it must be cheap. It must be cheap. So, this is the introduction of anticoagulant and coagulant drugs, that is hematological agent. Now, in this class, we have 4 drugs according to our syllabus, and we stated above we have 4 drugs: dicumarol, tromexan, phenandione, and valium. We discuss only one dicumarol in this lecture, and remaining 3 will be in next lecture. So we start synthesis of dicumarol. Dicumarol is also known as dicuman, dicumarol or dicuman, and it is synthesized by 2 compounds. One is phenol and second is malonic acid. Structure of phenol and malonic acid is stated here. This phenol and malonic acid is treated in presence of zinc and phosphorus trioxychloride, phosphorus oxytrichloride or POCl3. So it is converted into coumaron 2,4-dione. Coumaron 2,4-dione. We get, after this reaction, phenol and malonic acid in presence of zinc and POCl3, we get coumaron 2,4-dione. This coumaron 2,4-dione on rearrangement, oxygen we see detail in reaction. This oxygen is achieve hydrogen and remove double bond. We get 4-hydroxycoumarin. This is the structure of 4-hydroxycoumarin. Numbering start from this oxygen 1, 2, 3 and 4. 4-hydroxycoumarin. This 4-hydroxycoumarin, 2 moles of this 4-hydroxycoumarin is treated in presence of methanaldehyde. Methanal HCHO gives our final product for hydroxy 3 1 hydroxy 3 oxo 3 4 4a 8a tetrahydral ethylene 2 while methyl chromane 2 on. It is dicumarol or dicuman. 2 mole of 4-hydroxycoumarin in presence of methanol gives dicumarol. This is the synthetic root of dicumarol or dicuman from phenol and manolic acid. Now, medicinal application of dicuman or dicumarol. Dicumarol is capable of causing a delay in the rate of coagulation of blood. That is very important point. It delay in the rate of coagulation of blood, presumably by blocking the enzyme system responsible for the synthesis of prothrombin in the liver. So it is react in liver and synthesis of prothrombin and is used as a against post-operative thrombosis and embolism. And number 2, it is used along or together with heparin in the treatment of intravascular clotting. I repeat that it is used along or together with heparin in the treatment of intravascular clotting. This is the medicinal application of dicumarol or dicuman. Thank you.